Welcome back from the Southeast Health Unit. I'm talking with Jennifer Adams, and she happens to be the manager of clinical services. We're going to be talking about measles, and you may want to listen to this because it is quite involved.
Very much so.
Welcome.
Thank you.
You know, nice to have you. Thank you for coming in to talk about measles. And why is it so infectious? Like, okay, measles. What is measles?
What is measles?
Yeah.
So measles is a viral infection, highly contagious viral infection that can cause sometimes severe outcomes for people.
Yes.
Yeah, and it is airborne. It is an airborne virus. So again, a little bit different than COVID in that it does linger in the air longer than a COVID infection, for example, if we look at to compare the two, just to give people some context of why.
Yes.
So one of the things is that it does linger in the air for up to 2 hours after someone's who has the infection, has come into an airspace. And so it's 2 hours once the person leaves, so that virus can float around in the air for a couple hours.
Oh my heavens.
And you wouldn't know it. So you wouldn't have any indication that airspace that you're entering has been infected with measles virus. And a couple other things about measles is that it does typically present as a mild cold-like symptoms initially. And they can be quite mild, like fever, pain, aches, chills, cough, often associated with severe cough like a bronchitis, and red eyes. That's one of those distinguishing features of measles is like conjunctivitis, kind of red eye. And then a few days later is what you get is that very classic rash that people associate with measles. So the blotchy red, usually starts on the face and head, then spreads to the rest of the body.
Okay.
Yeah, and of particular interest is that people are infectious a day before they even show any symptoms at all.
You don't know.
Yeah, and 4 days before the rash comes as well. So because the symptoms are so mild and can be so mild in that initial phase, you wouldn't think anything of it potentially, right?
No, you wouldn't.
You wouldn't because it's mild, cold, like it's we're still tail end of respiratory season right now.
Yeah.
It's everybody's feeling a little unwell right now. It's not uncommon. And that's the challenge, right, with measles, and because it is so infectious, and basically one person can infect up to 18 people.
18 people?
Yeah.
Just being all in that one environment.
Yeah.
Oh, okay. So what group of people, because I've had measles. So other people my age probably had So what age group are we looking at that could potentially end up getting the measles?
And so it really comes back to the vaccination rates and vaccine. And so vaccine is the best preventable measure for measles. And what we know is widespread measles vaccination began in 1970. So if you were born previously to 1970, you were considered immune because almost 100% of children before 1970 contracted measles. Born, and so you're considered immune to it. So anyone that's born from 1970 to 1996 would have had one dose, because that's what the measles campaign at the time was to give that generation one dose. And you're considered immune.
Yeah, right.
Even with one dose for community transmission. And so what we mean by community transmission is that it's spreading amongst the general population. So as long as you have one vaccine and you're born between 1970 and 1996, you're considered immune. There is a caveat to that.
Oh, yeah.
If you're working in healthcare, you're attending university or college.
Yes.
What is the other one? Traveling. You might want to consider a second dose. Definitely for healthcare if you're working, because you're working with vulnerable individuals. You're coming into contact with a lot more illness and sickness and that kind of thing. So there are some caveats to that group of people. So talk to your healthcare provider if you are unsure, if you have 2 documented doses, if you're working in healthcare in those environments.
Right.
So then anyone born after 1996, that's when the 2-dose measles vaccination came into effect. So you are considered immune. You don't need any other there's no boost.
No,
There's no
no,
booster.
no.
None of that. Measles vaccine doesn't start until 1 year of age. So they get their first dose at 1, and typically between 4 and 6 is the second dose. So if we were talking about people who are more susceptible to getting measles, so anyone that's unvaccinated,
Yes.
so infants, anyone that's choosing not to vaccinate is at a significantly higher risk. Pregnant women as well, there are much more severe outcomes for women or people that get pregnant or are pregnant and come into contact with the measles virus.
Yes.
And anybody that's immunocompromised, of course. We always talk about that group is definitely at a greater risk.
Yeah.
The nice thing about vaccine itself is after 1 dose, it's 90% effective. After the second dose, it's as close as you can get to 100% without being at 100%. So, which is good. And the difference between this vaccine and some of the other vaccines is, I know when we talked a lot about the COVID vaccine, is that you can still get sick with the COVID vaccine. You just won't have a severe outcome or be as sick. With the measles vaccine, it's actually, you won't even get infected with measles, and so it's highly effective to preventing, and because it's airborne, you're contagious before you even know you're sick. It lingers in the air for so long after people leave. Once it starts spreading, it's really hard to control it.
Yeah.
And so vaccine is our most effective way to control that.
Yeah, preventative maintenance. Really.
Yep.
Okay, so for a person who didn't realize that they were going to have measles, what do they do? Is this something that like stay home and medicate yourself, or go to the emergency, phone your doctor? What should you do?
Yeah, absolutely. If you suspect that you've come into contact with measles, you start showing some, definitely stay home.
Okay.
Isolate at home. Ideally you should get tested for measles, because again, often by the time we become aware of it in the community, it's already spreading.
It's full blown.
Right? And that's a bit of a challenge in itself, but it's really important that people get tested for measles. And it's a simple swab, nasopharyngeal swab, so similar to what we had to do in COVID.
Right.
There's a urine as well. And sometimes they'll do blood work, but not all the time, but sometimes they will do blood work. But it's really important that if you think you have it, you need to call your provider, your healthcare provider, or call Emerge before you go, because again, because of how contagious it is, we want to limit the exposure to other people, especially when you're going to healthcare settings, a walk-in clinic, an Emerge, your people are already probably immunocompromised that are in the waiting rooms, right? And so they're more susceptible to becoming infected. So we want to make sure that it allows the healthcare providers a walk-in clinic time to prepare, because they need to do some preparation on their end in order to welcome you into their facility in a safe manner for you, their staff, and the others that are in the building as well.
Exactly.
So, yeah.
Wow. Oh my. Okay. Do we know how it started?
From what we can tell so far with this particular outbreak, because Ontario is actually in a declared outbreak, which is not a usual situation. It hasn't been we haven't had one in decades.
Yes.
So we can trace this outbreak back to October 2024 and a gathering that happened in New Brunswick. And so from that gathering, it has spread into Ontario, Manitoba. It's gone pretty far reaching. And so that's it. This is all continued transmission from that initial kind of index event that happened.
Yes.
And now it continues to spread in Ontario.
Wow. So other than Canada, is it like out there in other countries?
Absolutely. There is still global transmission of measles, and we always remember that vaccination is at varying levels throughout the world, right? And so not all have the same level of vaccine that we do here in Canada and even in North America. And so we do still see periodic single cases that are related to international travel within Ontario. Typically those we don't see as much widespread as we are seeing with this particular outbreak. So we still have some sporadic individual measles cases in Ontario that aren't connected to this larger outbreak.
Yes, because someone sees someone who sees someone who sees, they share. They all share.
And it's so contagious.
Don't share.
Yeah, that's the challenge with it.
What about people that are going on a vacation somewhere? They should get vaccinated before they go?
Ideally, and they should check with their healthcare provider. But yeah, definitely. And if you're thinking of traveling, especially to any areas where there is measles transmission concern, and it used to be international travel. We always talked about international travel, but even if you're traveling within Ontario, if you're going to one of the areas that is involved in the outbreak, and especially going to the specific communities that are being affected right now, it would be important to talk to your healthcare provider about whether or not you should, if you're fully vaccinated, do you need to get a second dose? Nobody needs a booster dose beyond two doses. But just to make sure that you are up to date with those vaccines. So
I'm also thinking about people that travel like on an airplane. You know, you have to be very careful as well.
It's an enclosed space,
It
right?
is.
Like
It is.
and so we always worry about air travel, and you often see there'll be from time to time notices about exposures to varying different illnesses that have been on cruise ships and planes and those kinds of things. So any travel, it is really important to ensure that when you're traveling that you have a good awareness of what diseases and infections are in that country or the place that you're going to, and consult with either your healthcare provider or a travel immunization clinic specifically. Who are well versed in travel vaccination, and depending on where you're going in the world, what things you need to get vaccinated for and those kinds of things.
Yeah, it's no sense going on vacation being sick, is it?
No, that's
no fun.
No.
No. Is there anything else you want to tell us about measles?
I can provide an update just locally of what we're seeing. So the Southeast Health Unit, formerly Leeds, Grenville, and Lanark, but it also includes Kingston. If you haven't heard, we merged Kingston, Frontenac, Lennox, and Addington, and Hastings, Prince Edward counties. So we're talking about Southeast. It's a big geographical area. So we are actually in an outbreak as a health unit, but specifically to the Hastings county. So locally in Leeds, Grenville, and Lanark, we have not had any cases. Our last case was in 2016. We've had one case in 10 years. So, but our immunization rates are similar to the province, where we have seen a decline in vaccine uptake, more vaccine hesitancy. So our coverage rates have come down a little bit since COVID, and we're working diligently to get those back up and do a good job with our coverage rates to help the community. So we are still considered a low risk for transmission here at the moment.
But that changes
it's really
day to day.
It could, right? That is the reality of how quickly the situation is evolving in the province. So we fully expect that could very well change, that we don't have community transmission, but that might not be the case as we move through the rest of this year, and who knows how much longer.
Exactly. It's just a matter of time before it does happen here in this area.
Absolutely. So important, and know what your vaccine status is. Have a conversation with your healthcare provider. We've been sending out lots of communication to healthcare providers about vaccination and who's eligible for what and when, specifically around measles, mumps, rubella, because that's the vaccine that measles comes in a combo with those other ones. And so really important that you know your status and that you know what you have been vaccinated against, in case we do ever get to that situation where we do have cases locally.
Exactly. Thank you for sitting down with me. I really appreciate it.
Not a problem.
Okay.